Hey docs, thanks for checking out my course. I made this course basically as a resource that I would have wanted for myself as I was starting my practice, as I was learning to grow my practice, as I was trying to grow a pediatric practice, because I've had goals for a long time of building a well-known pediatric clinic, seeing a lot of kids with a lot of developmental challenges and seeing a lot of those more severe cases. And this is the things that I wish I would have known when I started, because when I started out, I was doing general chiropractic care. I was, in those 10-minute appointments, maybe a 15-minute appointment. And now our care is completely different. We see kids for 2 hours a day. They come for a week or two at a time. Maybe we see them up even to 4 hours a day, depending on what's going on. We have so many different types of therapies to help these kids really develop more efficiently. And that's what our care is now all based off of, is getting these kids to develop more efficiently and helping them to thrive. And I want to teach you guys the things that I've learned over the last really 10 years to help these kids develop much more efficiently. And that's going to be learning about primitive reflexes, learning about vestibular function, eye tracking skills, different metabolic things you can do, different therapeutic approaches that you can take to help them develop much more efficiently and develop a lot faster. And also a side benefit of that is, as you develop this type of practice and start seeing these types of patients, it's much less stress on your staff, because you're not having a revolving door of patients that are just coming in. You're doing, 20, 30, 40, 50 appointments a day. You're doing a lot less appointments, managing a lot less care, and actually getting paid better for it as well. So from a business standpoint, you can build a much larger business, a much more scalable business, and also you can give much better care for those patients. So I want to show you what is all in the course here. So in the course, the first section is all over the important aspects of building a pediatric practice. And we've been able to build a really large practice with, in our Iowa clinic, 20, 25 people helping with patient care, 8 doctors, and built a large system that's able to help kids. And I talk about the important elements of that. But then the most important things is I teach you how to do an actual assessment, how to assess their energy levels, how to assess primitive reflex development, motor skill development, balance and ocular development. And these are true neurological assessments. So that way you know where that child is developmentally. That way you can explain it to the parent from a developmental standpoint that makes sense to them and gives them an understanding of why they should come see you, why they should be working with you instead of just another provider down the street. And when you learn the skill of being able to assess this and communicate these needs to a parent, you will not have any problem seeing that patient, helping that patient, and there's no sales involved. You're just explaining exactly what's going on. And then I teach you all the rehabilitation strategies for all these. So I teach you all about primitive reflexes and how to integrate each of the reflexes. Different exercises are in there of how we do that. This is my primitive reflex playbook, which is all the activities that we do for primitive reflexes. But secondly, and more importantly, the different areas of the brain that we stimulate to get rid of these reflexes. Then we talk about motor and sensory integration through all this, then vestibular and ocular integration of postural reflexes, semicircular canals, your ocular system as well, fixations. Then we start teaching about different therapeutics like laser therapy, high energy inductive therapy, Resi-Max therapy or sensory integration, exercise with oxygen, stim pod and vagal activities. And I think the absolute most important thing is I teach you my main 4 primary areas of the brain that are involved in these kids and how to rehab each of those areas of the brain individually. So different activities you can do for those, different modalities you can do for all those different areas of the brain. And we go into another important factor, which is nutrition and lifestyle factors that can stop the brain from developing appropriately. Then I teach you guys how to make a treatment plan, how to educate a parent, what you do after an intensive for home care, when you give recommendations for them to come back, how you educate them along this developmental process. So that way they understand that they're there to see you to help with a certain aspect of their development. We're going to have them do stuff in between, and then why they would need to come back to work on other aspects of development. So I teach you how to do all that. And also how to charge appropriately for your services. So you're getting paid for your knowledge and your time, and making sure that you are able to have enough cash flow to continually build your practice and add new equipment and add more staff to better serve this community, because we need more good practitioners. We need larger clinics that can serve people in this way so that we can really, really help them. And then some of my favorite aspects of this is I teach you how we get patients. how we bring patients in, the importance of using social media marketing, and how we organize a lot of that, which is really important. We also teach you how to shoot A-roll, B-roll, how to shoot videos that do really well on social media and bring patients in so you can help educate your community. And then we go into integrating it into your office, different things that you can do there to help make that transition easier. And we talk about goals as well for the future and the importance of planning your future. So I'm really excited to put this back out there again. I'm going to be teaching, it's over 7 weeks. I'm going to do 2 couple-hour lives. They're going to be at 2:30 Central Standard Time on Tuesday. I think it's the third Tuesday after it starts, and then the 6th Tuesday after it starts. And then there's also going to be a group where we can have discussions. You can ask questions. I can answer those on a weekly basis. So a little bit different structure than I've done in the past, but I'm really excited and to be able to do that for you guys and help you guys build this business and build your knowledge base so you can really help these kids at a super high level. So I look forward to seeing you side, and we'll see you soon.